After many months of great difficulty, pain, and sacrifice, today marks a new beginning, one of hope. My name is Peter Rice. I serve as the Division Chief of the PeaceHealth Medical Group, as well as sit on the executive team of the hospital. Every day for the past 10 months, our caregivers have provided exceptional, compassionate care under difficult circumstances of rapid change and uncertainty. What our caregivers have accomplished is extraordinary. Today, we're grateful to have with us two such caregivers, Amanda Schlecht, an RN who cares for patients in our emergency department and our COVID unit, and Dr. Charlie Jose, who is one of our new family medicine physicians in the clinic and in the hospital. We thank them for their service during this difficult year and for volunteering to receive the first doses of the vaccine.
You know, I think as a healthcare provider, we should be willing to take on the risk that we are suggesting potentially the patients with our treatments and vaccinations and everything that we do. And I think if this helps alleviate some concerns in the community, that I'm willing to take on these risks myself, and that is worth doing.
Being frontline, being in the ER where the most vulnerable people come in, it allows me to protect them. So they're not able to get it yet, so that allows us to be able to protect them. But with that being said, there is the incubation period for this vaccine, so it doesn't mean just because I get it today that everybody's safe. There is the couple weeks that takes for that to take effect, and
So with the Pfizer vaccine, as you know, it needs to be kept at ultra cold freezer temperatures, which is -80, colder than the lowest recorded temperature in the Fairbanks. And the good thing about this is that Pfizer and Moderna, they're not done. They're continuing to do all this research. So while this vaccine has an expiration date on it, they're going to continue to modify that as they have more data, which I think is awesome.
Sure. I mean, there's going to be vaccine hesitancy no matter what your profession is. It's not immune to healthcare providers. I think the biggest thing that we need to work on is continuing to give education and continuing to see, our other healthcare workers, our coworkers, our friends, our neighbors get the vaccine and see how well they do with it.
I think the other important thing, as Peter said, is if you get the vaccine, it's not a free pass to walk around licking doorknobs, not wear your mask, because that's going to be very important as well.
This vaccine gives us the confidence to take care of patients, and knowing that our caregivers don't have the opportunity, and that potential risk just goes way down for them, and that fear factor of our caregivers taking care of patients is basically going to disappear. So we're very excited about this vaccine. I was just telling Dana as we were coming down the hallway, I can't believe a vaccine could be such an exciting thing to have happen, and we're just thrilled to death that this is an opportunity so that we can all get back to our normal lives in the very near future.
I'm excited for the prospect of, as Amanda had alluded to, herd immunity coming sometime in 2021, 2022. I think everyone here, especially being on an island, we're excited to be able to see family that's far away. That's definitely something that's in the future for us.